Well, so excited on the podcast today. We have Rob Meeder, and Rob has been a part of Connexus since the very beginning, currently the chair of our elder board, but also a pediatrician with a focus on mental health, works right here in Simcoe County. He also co-hosts the Smart Family podcast with
Yep.
Tony Newhoff, like walks with families all the time as a part of his profession. And Rob and his wife Rose, they live in Oro with their kids. Rob,
hmm
really excited to have you today. Thanks for being here.
Jeff, I love being here, and I love talking to you about these topics, and so glad that Connexus is putting this in the spotlight again. We've talked about some of these things before, and I think it never gets old, and some challenges change over time, and families, but in a way, it's some things don't change, and we just need to hear again and again and be reminded and encouraged too,
Mhm.
um, about our kids and our families, and how we get through life together. So
Right.
I'm glad to hear that you're doing another series on this.
Yeah. Well, thanks for doing this. My wife Leslie, who is she's a guidance counselor, so I got her to help me like shape the questions a little bit today because she sees kids in her office as well every day.
Yeah.
What are kind of the common mental health challenges that you see in your office every day working with parents and kids and teenagers? And what are some of the common encouragements that kids or parents need to hear?
Yeah, that's a good question, and we should be aware that the kids that come and see me usually come after they've already been through some processes for getting help and support, and maybe they're still struggling, or the stresses are so significant that they feel that professional support is needed. And so it may not be totally representative of the broader population that's out there, and maybe most kids that you see day to day walking around school or at church. Um, but what it comes down to, Jeff, is we just see kids in families, and I say that it's in a way that's might sound kind of funny. Like, why do I say and families? Well, because sometimes we forget that kids are part of families, and
Right.
sometimes it's not like there's something wrong with the kid that needs to be fixed. Most often, in fact, it's what's happening around the child to what that child is reacting to, or what has happened around a child to that the child is adapting to or responding to in a certain way. And when those ways of responding to stress, they may be adaptive in the short term, but long term, they might not be so adaptive. Um, that's when sometimes we run into problems where functioning at school becomes difficult, functioning within the family becomes difficult. People around that child will find it more and more challenging to kind of get through a day. That's when we say, okay, look, there are some mental health concerns here. We're all stressed, we're overwhelmed, and the child is overwhelmed, or the youth is overwhelmed, and we need just some help to get through the next level. And so but what is encouraging to hear though is sometimes reframing it like that. I do a lot of reframing behavior and things that we see. Because sometimes if we kind of see it as this is not just a kid trying to be bad or acting out or pushing buttons or being annoying on purpose. Most kids don't wake up in the morning like, how am I going to sort of tick off my parents
Right.
today? No, like most kids do the best they can with the tools they have in the situation that they find themselves. And sometimes those aren't the best tools because of where they're at developmentally, or, the situation that they find themselves in. And that's what causes the problems. And so generally we kids will do well if they can. Kids do their best. And sometimes that still is not what enough, and or does is not really appropriate for that situation, and that's
Mm.
when problems arise. And so kind of reframing it that way sometimes can be an encouragement for parents just to kind of reflect and see things through those kinds of lenses. Sometimes it's quite eye-opening because families get here sometimes being told like, look, there's something wrong with your kid, like there's something wrong with their brain, you got to get them checked out there. And then you're like, well, you know it'd be kind of weird given the situation that if they weren't responding to stress in some way or another.
Because of what they're facing.
Yeah, yeah. And so let's just sit back and just maybe a bit more pragmatic about it and say, what are the actual difficulties right now, and how do we help you and your family and this child get through some of these difficulties? And that's rather than kind of focusing on like what's wrong, it's like why are we seeing these behaviors? Why are we seeing these things? And sometimes kind of reframing it like that can be really encouraging for families. So um, I guess that's where my conversations go a lot with families these days.
Now, and you're often dealing with families in a crisis situation or a perceived crisis situation for them. But for the majority of parents, they're trying to be preventative. They're, hopefully they're in a preventative situation and they're looking for tools around, hey, what can I be doing to have healthy conversations about mental health? What preventative things can I do with young children? I think, and then teenagers. What are kind of some of your tips on that kind of thing?
Yeah. So when I got into mental health, I didn't always used to do just mental health. It was about 10 years ago that I switched my pediatric practice to just mental health. And as I we don't get a lot of training in mental health. You'd be surprised as pediatricians. We get a lot of training about, kidney disease and congenital heart disease and asthma and diabetes and stuff. And we spend about as much time on the brain as we might say learning about the kidney.
Right.
And but I would say though that the brain is a million times more complex than the kidney. No offense to nephrologists out there.
Sure.
Um, and yet we try to make it seem like a simple thing that, where there's sort of 6 or 7 disorders that we have to diagnose in kids. And that's a gross oversimplification what's really going on.
Mm.
Our brains are the most complex organism, like computer in the universe known to man.
Mhm.
Like there's literally an insane amount of neurons in there firing all the time, reacting to the environment around them. And so when I got into pediatrics, in mental health, I realized, gosh, I got to learn more about this. And I started going back further and further. Like, how does all this start? How does all this start? I went down to like, well, how does personality develop? How do some of these mental health disorders develop? And found myself just going back further and further to younger and younger ages, realizing that a lot of mental health, if not all mental health, has some foundation in the relationships that exist around a child from the very early days,
Mm.
even prenatally. And so, what that child experiences in terms of stressors and the environment and relationships really kind of set the foundation for how well that child can cope with stress later on in life. And if there's a lot of stress early on in life, that brain kind of gets tuned to considering the world as being a stressful, threatening place. You got to be on your lookout all the time. And that kind of alters the developmental pathway for that child to the point where some of their behavior becomes a bit, you know, not great in down the road and leads to lots of these physical and mental health concerns that we see down the road. So I was really important that we focus on those early years. And what we really want, what we're going for, is to, as families, we should be looking at providing what's called stable, secure, nurturing relationships, SSNRs. We have acronyms for everything in
Right,
medicine,
right.
not one.
Doctors always have acronyms. That's right.
Yeah, it's kind of, makes it sound more official, I guess. And
Right, right.
but but really what we're looking for is stable and secure, nurturing relationships. And each of those terms has a specific meaning. But the goal is to really establish a secure attachment so that we want kids to feel secure in that relationship with at least one primary caregiver, if not both. Usually that's the mother and father. Um, the parents. And sometimes it's other caregivers, sometimes it's a grandparent, sometimes it's an aunt or an uncle or whatever like this. But generally, it's parents, and we those kids. I mean, they have to have as babies. You're helpless. You have to have someone to look after you, and that security really promotes down the road independence, confidence to explore the big world. And so it's a little bit opposite what we think. Sometimes we have to feel like we need to train babies to self-regulate. What they actually need is they need a lot of co-regulation from their parents, so that down the road they feel safe and stable and secure to self-regulate and to to do their own thing and to explore, knowing that they've always got that safe that stable, safe base, that safe haven to return to when they need to. And as they get older, that becomes less and less of a concern, which is how teenagers eventually kind of let go of those, parental bonds and start to explore the world on their own. And I've just sent two to university, and it really is a different phase in life. And I'm happy to see them go on independently and problem solving. They still call us, and that's fine. But that relationship morphs, and it should. And so it's nice when we see families kind of going through these phases, these transitions. It never happens totally in sync. There's always the parents that want to hold on a little bit more or let go too soon, and vice versa for the kids. Um, but in generally, the better that happens, sort of at the same time, the smoother those transitions are as we move as parents through these different phases of our child's development to the point where eventually we do send them out into the great big world, and one day they're looking after us.
That's interesting. I forget who it was, but I was reading something about building anti-fragile kids and the
Oh yeah.
need to build resilience in the life of kids. And it feels to me like there's two schools of thought. One is like bubble wrap your kids, don't let them take any risks, just keep them safe. The other is like just let them skin their knees, and let them just figure it out on their own. And what you're saying, it sounds like to me anyway, there's a it's kind of somewhere in the middle, and you're trying to kind of drive between 2 and 10. Like, is that kind of what you're getting at?
Yeah, yeah. But what I would say is, because you're saying like it's the bubble wrapping approach, which maybe eventually becomes sort of the helicopter parent, snowplow parent
Sure.
down the road, versus, the permissive parent, just like whatever happens, happens, kind of hands off, things will develop despite my influence. And I'm what I'm saying is that it is somewhere in the middle, but the beginning should be very skewed to that nurturing part of the stable and
By the
secure and
beginning, you
nurturing
mean age
relationship.
wise from the right.
At the beginning, at the baby phase, in the first few months and years of life, we should err on being over nurturing rather than being under nurturing, because
Mhm.
that is where the foundations of mental health are being laid down. And babies develop best when there is that real sense of security that happens. And so that's not the time to let, a baby figure it out on their own and
Right,
sort of
right,
cry it
right.
out and like, kind of minimizing or dismissing. That's actually when we need to be there more sometimes than our society thinks. And that then becomes a foundation for them to be actually more independent down the
Mm,
road. So it's a little bit opposite of, even how I thought when I was a kid, which is okay, even when I was sleep training my kids, for example, it's sort of like, well, they can't always be thinking that I'm going to show up, whenever. Um, but um, that's actually a little bit backwards thinking, because at the beginning you really want to show up for them and let them know that they are secure and safe and that somebody's going to look after them. And then that promotes healthy brain development, which down the road makes them much more likely to be less dependent on you when,
fascinating.
when they're older kids and teenagers. And then, you won't be their snowplow parent at
Right,
that phase.
right. Oh, that's so
You don't
helpful.
need to be. Yeah.
Yeah. So then, okay, so we're going along the journey here as kids are getting older.
Hmm.
Um, I think I don't know if it's every parent, but a lot of parents get to a
Yeah.
point with their kids where they go, hey, is my kid developing at the normal rate? Are the behaviors I'm seeing normal? Um, I hate to use the word normal, but
I know. I was going to
are
stop you right there and going like,
yeah,
what's normal, Jeff?
or the
Can you
behaviors, but the behavior, yeah, exactly right. Whether the behaviors I'm seeing healthy, like maybe that's a better way to put it. Um, and when do I need to seek outside help? Like, do I need to see a counselor? Do I need to see a pediatrician? Like,
Mhm.
how would you sort of advise a parent to make that kind of decision when they've got questions about just whether their kid is mentally in a healthy place or not? And do I just need to like read a book, or do I need to actually go and see my doctor or a professional of some sort?
Yeah. Well, first of all, most kids are, of course, fine. And there is a variation in how kids develop. Like, no kid develops at the same rate. And sometimes you have some kids who just kind of like blow it out of the water with their motor development. But then when it comes to social emotional development, they're lagging. And,
Right.
they get to school and they have difficulty with hands-on behavior or with sharing their toys. But, they're running around the playground like there's no tomorrow, climbing on everything, jumping, and they're awesome soccer players and everything. So developmental domains, we divide those up. They do go at their own rates, and we have norms. We have sort of kind of ideas of like, hey, your kids at this age, they should be doing this and this, and there's some good tools to assess that most doctors can do. There's most regions around our province and our country have organizations that do developmental screening. Um, but generally, primary care providers, whether it's nurse practitioners or family doctors, are trained to do that. There are other childcare organizations that do this as well. And yeah, you always are going to compare a little bit to siblings and compare to other kids in the child's class and realize, and sometimes teachers will tell you, look, hey, we're 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 kind of outside the norm here, and you might want to get this checked out. And then that sometimes leads to a referral to me. And a lot of times kids come to me because issues have risen at school where teachers are like, well, I've taught this class for 10 years now, and what we're seeing here probably needs to be investigated a little bit further to make sure that everything's okay. So there are tools to do that, but recognize that very often I am actually telling parents, um, it's okay. We're still, within normal limits, or even just with some insight and maybe a couple of things that you can do at home with your child, um, is going to help close that gap, and we don't need to worry too much. And I really try to not over pathologize variations of normal as being
Mhm.
something that's a problem. On the other hand, if I'm concerned and this does look like it's causing a lot of issues and problems, well, then yeah, we need to go further and see if there's something else that needs to be addressed.
Mhm. Mhm. Another question I want to ask you, Rob, it's one that for Leslie and I, she sometimes faces it at school as a guidance counselor. I've walked with a number of families in the same situation where either child is struggling with depression, struggling to kind of motivate, get out of bed, kind of they lose the ability, not the ability, or they struggle to engage the world. And so
Yeah,
it's, hey, I don't want to get out of bed. I can't go to school today. Or it can be a social anxiety.
yeah,
So I can't walk in the building. I can't go to school. I can't go to church. I've had that too. I can't go to any space where there are a lot of people. It's really heartbreaking because a parent can really feel ill equipped into what steps to take. And maybe one day, maybe the next day they go to school and they do okay, but then 2 days later they're struggling again. And I've run into parents say, I just don't really know what to do. I'm not going to make a 15-year-old, you know, get in the car and go to school. If a parent is facing that, what's kind of your encouragement to them as to what steps
yeah.
they should take or what tools they should look for?
Well, so what you're describing to me are the sort of visible behaviors that, of a child who's disengaged and who's not wanting to go to school. And so that's the what that's going on. And then the question is, well, why are we seeing that? And what is the stress to which that child is responding, that this is how they're communicating that distress? And so that's again going to, well, it's nice to know the what, and sometimes we think, okay, if I just had a diagnosis, then I'm all over it. But that's not really the most helpful thing. Is you got to go a step further and diagnose the diagnosis and realize, oh, okay, why is this happening? What are the driving factors behind this? And that's the hard part. That's where we have to be patient. That's where we have to be maybe a little bit parent detective, parent scientist,
Mm-hmm.
to sort of figure out, wait, where did this start? Where did this come from? And the hardest part, of course, is when when that child or youth is not really able to verbalize that, and we're kind of left stuck a little bit.
Mm-hmm.
Maybe hearing from friends or from other family members what they've observed, and sort of trying to piece together of like, why, how do we get here, and how do we kind of unget here, right? How do we get unstuck? And one of the things we want to do is, like, you're talking about maybe a child who might be avoidant, like they're towards avoiding school, and you always want to try to avoid the avoidance. And that's
Mm.
one of the terms that we use here. And so, as much as possible, sometimes these things are parts of downward spirals where we just see kind of one behavior, and then we're like, okay, well, then, can stay home for today. And well, then, the next day they're behind in their schoolwork. And then next day they're like, well, what will people think if I go back? And then, it becomes harder and harder, and you miss more and more. And the ability to go back to school, for example, just deteriorates every single day that this
Right.
absenteeism lasts. And then you realize, okay, now I'm in a hole. How do I get out of this? And this sort of downward spiral has become really entrenched, and it becomes harder and harder to bounce out of that. And kids who are resilient, that's actually what the definition of resilience is to kind of get out of that hole and to find yourself more of a positive state of mind where you're able to deal with some of the stressors. But yeah, some kids can get really stuck there, and it's really, really hard to kind of get them to take that first step back to, okay, I don't feel like going to school, but I got to get to school. And
Mm.
sometimes, new beginnings are a way to sort of make that happen, whether it's the start of a new semester or a new course or even the start of a new week. Um, After a break, on Mondays, okay, let's see if we can get back there again. But yeah, sometimes the anxiety is overwhelming, and you gotta figure out, okay, why is that, and what's my role in to sort of help understand that, what's happening around this child that's making them respond, that this is sort of the best way they can think of to deal with whatever stressor is that they're trying to avoid or work through.
Mm-hmm.
So
Mm-hmm.
it's not easy, Jeff. And the fact is, the problem is that there's about as many ways to get to that level of function as there are children in the world, and everybody is unique and different. So I can't really say, here's what you do in this situation. Um, but it is important to, recognize that this behavior is here for a reason. It just doesn't come up because, there's some chemical imbalance or whatever, and despite the child's best efforts and wishes, they just can't get out of bed. There's a reason behind it, and we shouldn't just automatically jump to conclusions that this is what it is or that's what it is, but really try to be detectives and figure that out.
Mm-hmm.
And maybe at the time of the most distress, that's not the best time to sort of engage in some cognitive reflection.
Right.
Maybe take some time, and maybe it might take a few days, and maybe be another person that needs to help a child, learn to express what's actually going on in their minds that's causing them to behave and to act in this way, uh, to deal with the stressors that are going on in their life.
Yeah, a part of what I hear you saying is, you have to be an investigator and find out the why, and also, um, like you have to be patient, and because I would just be like, we're gonna fix this right
Yeah,
now, and not give myself a break or the kid a break and the space to kind of figure out because it could take a little bit of time.
yeah, yeah. And like I said, and usually there's something going on, and we just don't have the backstory quite yet. And it's in some way you and the child need to figure this out and kind of understand it, and learn to manage that stress. Um, but yeah, you don't want to get into a situation where it's like, well, I have this disorder, and so that I can't go to school, my social anxiety, I can't go to school. Well, let's figure out why that is. What is it about
Mm.
school that's so stressful? How do we work around this? How do we mitigate some of these stressors? How do we give you more tools so that when you're feeling stressed like this, you can calm your body
Right.
down and get through some of these hard times?
Yeah, one of the things I have to say, I mean, I've shared before my struggles with anxiety. There's nothing like finding a tool that works. Like
Yeah,
it can change your life. Like I remember a counselor helping me with whenever if I'm feeling really anxious, I'll try to withdraw from a situation. And the
yeah,
question I ask myself is, well, if I were healthy, what would I do? And then
yeah,
I have to do that, even though I don't want to do it. Oh, if I were healthy, I would go out to dinner, even though I'm anxious about going out to dinner, or, those type, that little tool there, really changes everything. And there are a lot of tools out there if, as you kind of discover what's going on.
Yeah, I have this too. Like sometimes I go to work and some stressful things are happening and I start to think about my day and I kind of feel myself get more and more kind of worked up psychologically, you know? I'm sure my blood pressure's up, my heart rate's probably up from what it is at
Sure.
baseline. And I get into these sort of thinking spirals where it's like, oh no, I forgot to do this, I got to do this. And then suddenly I find I'm just very angry. I feel myself uptight. Like physically, I feel just tense. And then I have to realize, okay, just like step back here. And I actually do like intentional deep breathing.
Hmm.
Just hold it, breathe out calmly. And it's like that flood of neurochemicals just calms my vagus nerve and my heart rate down. And immediately I feel less tense. I
Hmm.
feel calmer. But my situation is actually still the same. I'm still going to work and
Right.
having to deal with some of those struggles. It's just that how I'm reacting to it, I'm in control of that. And it's amazing how we can control how we feel that level of stress just by something as simple like what I do is breathing. For some people, it's like getting outside and going for a run. For other people, it's just getting some fresh air or just calling up a friend and talking through it. Like there's ways, listen to music or singing. Like
Hmm.
there's all these
Hmm.
different things that we can do that kind of help get us out of those stressful situations, feel that sense of connection, belonging, community, health, vitality, nature, that can get us through some of these tense moments and realize, okay, I was working myself up, and I didn't need to, and I calmed myself down. Awesome, and that's empowering.
Yeah, I know from my kids, one of the greatest things has been when you realize they find the activity that lowers their stress level,
Hmm.
whether it's sports or art or mute playing in the band at school, music, whatever, because
Yeah,
you have that tool for the rest of your life. It's a pretty
yeah,
special thing.
yeah. But I would say the most protective thing is if that child has, and you or youth has, um, good, healthy relationships around them.
Hmm.
And because none of us are going to get through our mental health issues unless we feel that there's somebody in our corner that's rooting for us, that's praying for us, that's helping us out, that we can go to when we feel overwhelmed and stressed out and disconnected. We need people in our corner, and that's why I focus so much on relational health. I think so many of our mental health issues have their roots in strained relationships and stress relationships. And so much of the healing happens in the context of relationships. So
Hmm.
it goes both ways. And so having those secure relationships just is a cornerstone, is a foundation for good mental health for sure.
Now, for sometimes for people, hiring a counselor is that can actually be a helpful relationship for some people. Like obviously friendships are great, want to have family relationships, but I have some people who say like I'm really stuck and I don't have anybody to talk to right now, and I'll say, hey, maybe you should go to a counselor. I've had parents ask me, I'm curious your thoughts on this. When is a child old enough that a counselor is helpful? Like, hey, we've been through something traumatic as a family, or maybe, our marriage hasn't worked out and there's been a lot of conflict. I'd really like my son or daughter to talk to somebody. Like, at what age is that kind of a counselor a helpful thing?
Yeah, so counselors will do different things. Some are definitely more play focused and some are more talk focused. But in general, counseling is a strategy that works best for older kids and teenagers, maybe, and adults for sure. Um, we should be careful that we don't sort of transplant what works for kids onto adults and assume it's going to do the same thing because developmentally kids are at a very different stage. And I also sometimes feel like that as parents, we should be our child's counselors. We should be doing that role. And sometimes we do need therapists involved because we might need help. In fact, some of the counseling that I do is just empowering parents to provide support for their kids. And so I'm kind of counseling them to be the counselors for their kids.
Mm,
Because I mean, ultimately, I think that's going to be the long run game in these families. So I'm not saying that I'm against counseling. I feel like sometimes we just jump to it a bit too quickly
Hmm.
in ways that is maybe a bit too complex for kids. Um, it's also, sometimes counseling it needs to be done right, and sometimes there's this power dynamic that exists between a child and a counselor. And sometimes, parents expect that the counselors just kind of get some stuff out of the child and then report back to them. It's sort of like this
Right.
secret agent kind of relationship. And it's like, wait a second, that's not really fair either. And on the other hand, do we want our kids developing a really confidential relationships when they're young with a therapist, and you as a parent are just kind of kept completely oblivious to that? So
Mm.
I feel like it can be a fraught area that we have to just be careful and say, like, is this really needed? Because ultimately, counseling works best when the person who's receiving the counseling can challenge the counselor sometimes too, and feel like maybe and have the ability to reflect on what's actually been happening in their life. And that often is not the case until you're into your adult years. And so often I get parents who are like, oh yeah, we're on the counseling, but I didn't want to participate, And of course, if the child doesn't want to do it, nothing's going to happen, especially for
Right.
teenagers. You can't
Right.
drag them to a counselor and just say like, hey, open up, share your emotions. And I get this, frankly, a lot of the times. I get families sort of plunk their kid in front of me going, okay, talk to the doctor. Well, they just met me for the first time, and I'm not
Right.
expecting that you're going to spill all your emotions to a complete stranger that you've never met before. Um, and so it doesn't quite work that way. And so we have to really make sure that that it's that sometimes, well, I was going to say that we can't if it doesn't work in those teenage years, it may not actually happen until your child's in their 20s or 30s or
Mm.
older, and that's when they actually want to go and unpack and process to the level that you're imagining that a child can do right now, which
Right.
is often not the case.
Right.
And often teenagers, for very right reasons, just don't feel safe to do that with a therapist.
Yeah. In some ways, it sounds like in some ways, if the best thing you can do if you're is to go to a counselor yourself, and if they can help advise you how to have a proper like a good conversation with your child, that's probably a better approach than dragging your child to the counselor and saying, hey, fix my
Absolutely.
child, if you want to use that term.
Absolutely. And in fact, for young kids, the younger the kids are, the more that becomes almost the entire focus is like, how do we empower kids to be the support for their parents, for their children, sorry, um, at home?
Mm-hmm.
Because, most mental health happens through the everyday routine interaction that you have with your children.
Mm-hmm. Mm-hmm.
Most mental health support happens in those regular routine after school conversations, dinner time, banter, putting your child to bed, driving them to the soccer game. That's when all the mental health therapy really happened. That's mental health,
Mm-hmm.
doing those things.
Mm-hmm.
And if you do that regularly and you're really committed to spending time with your child and letting them know that you're there and you're helping them regulate and co-regulate, the bond will be there for that to happen naturally when your child's under more stress and they feel overwhelmed. That's when they're
Mm-hmm.
going to come to you because you've normalized that sort of a relationship, right? They feel secure and they feel safe with you.
Right, right. What are your thoughts on the role of medication, Rob? Often I'm sure you get questions about that. What
Mhm.
are what are your thoughts around that?
Yeah. So there are, medications we sometimes have to just zoom out a little bit and say, okay, when do we use medication? And there's no doubt that there's medications which are essentially substances and chemicals that interact with your brain to cause psychological effects. And so sometimes that can help, decrease stress levels or smooth emotion or kind of blunt emotions. Sometimes it's just the way you frame it too. Like, emotional regulation could be emotional blunting too if it's too much. And sometimes
Mm.
that's the main reason people stop medications because they don't feel themselves. They don't feel like that's their emotional self. But on the other hand, sometimes the intensity of the emotions are so strong that medication can kind of help calm that down. Um, But, we do know that there's lots of these psychotropic medications that are out there that have effect on your psychological functioning, but they're probably not as specific as we think they are. In broad categories, there's things like stimulants that we use for diagnosis like ADHD, but those are stimulants. And if you think about, well, what does a stimulant do? Well, I have a coffee every morning. That's my stimulant, my caffeine. And this is just another version of that class of medication that's maybe, kind of controlled, dosed and stuff like that and monitored quite closely. But we have to sometimes step back and just say like, okay, yeah, there are psychoactive substances that we can use that have some effect on our brain and brain function, and sometimes they might help your focus. And so sometimes that's a tool in our toolbox that we need to use. But they all have side effects as well, and there's pros and cons. And again, sometimes these help to deal with some of the physical effects of the emotional dysregulation that we might have, or the anger or the reactivity, and that we have when we're faced with stressors. But we should never forget that they don't really address often the why of that situation, right? So they
Hmm.
might sort of deal with some of the surface intensity of the behaviors that we see, but we still have to understand why we see those things. And that sometimes is ignored when we think that the medications are going to fix everything, but we don't deal with the why that's driving those behaviors that we're trying to address.
Hmm. Hmm. Back to like be an investigator. Parents have to be investigators, which is helpful.
Mhm.
Talk to me a little bit about the church, and we want to help destigmatize the mental health conversation in our church, in the church always. What do you think are some helpful things that we can be doing to help continue to kind of destigmatize the conversation around mental health?
Well, it's just what you're doing right now, Jeff. When you were up there, recently talking about how, we our drive to be the perfect parents, when in fact, and there's this really great principle in relational health, which is called being the good enough parent.
Mm,
And you were definitely like preaching along those lines. Like, oh man, this is great. Like you are communicating some real amazing principles for parents and for families. And just talking about it in everyday terms. Like I said, it's in those routine everyday interactions is how we just provide community for kids. I think that's one of the most important functions of the church is to be a place of community, of relationships, of widening that circle around your child so that there's people who are committed to being there for them and to help you help them. And I think we need more of that in our world because we tend to feel like and honor sometimes the people that do it all by themselves,
mm,
the people who just kind of pull themselves up by the bootstraps and that whole kind of individualistic type attitude. That's actually not very healthy. We need to honor and respect relationships and relational health. And I think the church has a unique role in being that kind of place for families and for children, where we're that village around the child.
right.
So talking about it, providing that environment, and also just validating that, look, life is hard, man. There's going to be stressors, and nobody is asking you to be a perfect parent. In fact, being a perfect parent is impossible, and B, actually not good for your kids. We
Mm,
want kids to have a good enough parents so that they experience some of those stressors and they learn to cope with some of those stressors and they become resilient in that way. Now, we don't want our kids exposed to toxic stress, of course not. Like we want to avoid that at all costs. But going through the ups and downs of life is essential, um, as our kids get older so that they learn to manage those stressors. And that's actually healthy development. That's actually healthy parenting. And so being an imperfect parent is actually the ideal situation for
mm,
optimal development.
mhm. You know what I appreciate about you, Rob? You make it feel doable to me. You don't make me feel like walking with my kids when it comes to their mental health is some kind of really difficult thing. You make me feel like, oh, I could do this. Like, okay, I can have these conversations. So this kind of last question, you got four kids, two who've just gone to university. So you've walked with, your kids for a while. You've been a part of our church since the very beginning. When you look at time spent with your kids over the years or now, this is sort of from a spiritual perspective. What are some things that you've done that you go, man, I think spiritually, when it comes to walking with my kids, these have been some helpful things when it comes to not just their mental health, but their spiritual life as well, and just helping them figure all of that out, their own mental health, as well as their own lives, as well as their own faith. What have been helpful things you've done?
Well, I can't say that like I'm proud of my kids and they're incredible kids and you know them
Yeah,
and they've had their issues as teenagers and stuff
sure.
like that. But in general, there they are. They're in high school and they're doing well and they're, I think, leading fulfilled lives and they're off to university. But I am so grateful for the people that have helped me along the way, being the parent. Um, and because if I had to look back, I say I wish I would have spent even more time with my kids than I did. I
Mm,
mean, I had a busy job, obviously,
sure.
and Rose still has a busy job as well. But despite that, we always did prioritize family time.
Mm,
We really tried to provide as much stability for our kids as possible. And I know that's not possible for every family. Stuff happens. Um, and everybody loves their kids. Like that's my underlying basic assumption that people
right.
want the best for their kids. They love their kids. And when, you're forced to make some decisions about which school they go to, or you have to move, or there's a breakup in the family, like that does happen. And sometimes that's outside of our control. And it's not like anybody chooses misfortune to come to them and that to befall their kids. But I feel like we've been lucky and we've been blessed in that way to have a community around us of friends. Rose and I, we still connect on a regular basis with a group of friends that we've had for so many years, and they've tracked with us. We've tracked with them. We've always prioritized being in a small group, Rose and I, with
Hmm.
other couples, and that's couples at all stages. So we've learned from people who've gone through it. We've learned from people who are about to go through it.
Right.
We've been a support to people who are going through it. And so that kind of support is amazing. And the fact also that Rose and I, we regularly still see a counselor. And that's not because, we're like our marriage is on the rails.
Hmm.
We have this typical stuff that every couple, I'm sure, goes through to some extent.
Sure.
And meeting with our counselor on a regular basis just to talk it through and to have a discussion has been super helpful. And because if our marriage is good and we love each other and we have the best, our kids can see that. And that
Right.
when they see us working on it, and when they see us argue and then we apologize to each other,
Right.
that's
Right.
huge for kids
There's
to see
power
that
in
we
that.
make mistakes but we repair.
Hmm.
Because life is full of mismatches and repair. And that's in your relationship with your spouse, and that's in your relationship with your kids, and that's amongst your kids. Mismatch and repair, mismatch and repair. And the mismatches are always going to occur. It's how
Hmm.
you repair it afterwards that's most important.
Hmm.
That's what I said too. Like that good enough parenting. There's always going to be stressors, and when they happen, but how do you help your child get through those and support them as they manage some of those stressors? So these are all key principles of relational health that before I even knew what they were, kind of had already
Right.
sort of kind of worked on within our family. So prioritizing meal times together, super important. When our kids were born, screen time wasn't huge, but that's a big issue right now, and something that maybe we could talk about down the road as well. But it's a big issue right now is social media device uses, et cetera.
Hmm.
Um, but kind of putting those away at meal times and at bedtimes and having some guidelines around that. Um, so it's those everyday, day-to-day interactions that build the relationship. It's not like the counseling boot camp or
Hmm.
or or some book that you read that suddenly gives you this aha eureka type moment. I mean, there are those that happen too in parenting,
Sure.
but that's not really what builds mental health. It's the routine ups and downs of everyday life and how you support your kids to get through those.
Yeah. Love it. Well, thanks, Rob. I mean, this has been so rich. So just really, really appreciate your time. And just thanks for investing us. Smart Family Podcast. Everybody can find that and check that out. And you'll see Rob around Connexus, especially if you're at the Aurelia location. And again, just thanks, Rob, for your insight and your leadership.
And Jeff, thanks to Connexus for being that community around my family. And we've had our kids go through Wambaland and Transit and Upstreet and Inside Out. And that's been a huge support. And I really wish that for every family in our region. And if you're outside this region and listening to this, find a church community, because not only for that community aspect, but it gives purpose and meaning. And that's sometimes what's lost, and sometimes what our teenagers struggle with is they don't know what they're here for. They're working, they're trying to figure out kind of their identity.
Right.
And having purpose and meaning in life, if you don't have that, it can lead to a real crisis and real existential crisis. And that's not just big words and philosophy. That's true, and that can really be disorienting for teenagers. And so having a connection, whether it's at camp or church, but definitely having that spiritual connection, like there's something higher here. There's a purpose in my life, and
Mm.
someone cares for me and loves me who is perfect. That's God our Father. That's a really important message to instill in our kids from a very young age. And Connexus has been that for my family. So I didn't want to end this podcast without saying that,
Oh,
Jeff.
well, I appreciate that. And if you're a volunteer and you're listening, you can hear through Rob, you're making a huge difference volunteering in the lives of kids and students. So thanks for all you do. Thank you, Rob. Really appreciate it.
My pleasure.